Hello, everyone. My name is Bettina Borisch. I'm the CEO of the World Federation of Public Health Associations. And today I have the pleasure and honor to be with an amazing guest in this podcast. The amazing guest is Emeka Iloegbu. He is a long-term World Federation pillar, I would say. But before I start to talk too long, I would ask Emeka, could you introduce yourself, please?
Yes, definitely. Well, first, I would like to thank you, Bettina, and the Federation for this opportunity to speak on the podcast. My name is Emeka Iloegbu. I am an assistant program director as well as an assistant professor at the City University of New York in the laboratory science program. I'm also a laboratory epidemiologist and microbiologist and have worked in a number of different laboratories during a number of different health emergencies. I am also representing the World Federation of Public Health Associations in a number of different capacities, of one of which being here in New York, being able to represent the Federation at the United Nations headquarters here. I am also a member of the Global Health Policy Task Force, as well as co-chair of the Public Health in Emergencies and Disasters Working Group. I am also doing a wide range of fieldwork right now with the Geneva-based organization, Market Access Africa, and have a range of projects going on. And I'm happy to be here and to really dive in and have this rich conversation.
Thank you, Emeka. As we listen to you, we are already flabbergasted, but let's put it part by part because if someone young listens, says, wow, I'll never manage all this at once, it
Yeah,
starts somewhere, does it? And I
it
would
does.
like to ask you, where did it start? Especially, where did your travel with the World Federation start? I remember that you were an intern with us some years ago. And
Yes.
how was your first day at the World Federation offices?
Yes, yes. So thank you for this question, and all the memories are starting to come back. Let me first start. My journey in public health and me even getting to this point, I will say has two trajectories, and the genesis of which I believe started with my mom. When coming to the U.S. From Nigeria and meeting my dad, my mom's first job in New York was as a public health nurse. And so she would do her community work, and I would be sitting in the car with my brother, and I'm watching my mom in her nurse outfit going door to door with her survey. And then she'll get back in the car and then document her observations, and I'm just seeing her doing her work. I'm like, okay, okay. As a kid, not knowing what's happening, I believe at that point there was a seed that was planted. Fast forwarding years now, coming into, I will say, fall of 2027, I was in my second year of my master's in public health program at Mount Sinai Icahn School of Medicine. And I knew I needed I was already interested in doing global health work, and I've done a number of field-based projects at that point. But I wanted to understand what was happening at the policy level around the world. What were those conversations like? So this thought process occurred when I was working in overnight shift, 2 a.m. in the morning, in a hematology laboratory at New York University. And I did a quick Google search and I found the World Federation. I sent an email with my CV, very excited. And at this point, having gone through that and arriving in Geneva as I fast forward, um, I will say walking to campus biotech was quite an experience. Well, first arriving in Geneva without the proper SIM card it's quite the experience. Arriving in Geneva at 8:30 p.m. at night, without the proper SIM card, and having to find my way from the airport to Plan Palais, and which I was able to manage, of course. But day one, I will say it was absolutely amazing. And this was 2017. I was able to spend 3 months in Geneva, at the World Federation of Public Health Associations at Campus Biotech, and having been able to not only work with the Federation, but meet so many amazing people. I will say I had an energy within me that I will say has grown since then. There was an energy within me then to know the work people were doing, to understand their passion and why they were doing it, and to then also understand the impact that they were making, both in reality and perceived. And so those 3 months in Geneva at the Federation was quite transformative, I will say. I was quite an active intern, and I was really engaged on multiple levels. And even when not really knowing certain processes, just walking down the street, seeing UNHCR and say, let me just walk in and see who's in here. And that also, in some ways, led to amazing conversations and interesting connections. And so, as a young professional, then I believe that the World Federation and in that environment, I was able um, to grow and to find myself at this point now in my career. As you say, Bettina, it doesn't all happen at once. There are steps that occur, and I think that most of which we do the best we can to make those informed decisions. But I think it's the institutions we collaborate with and the people we meet that help allow us to make those informed decisions.
Yes, and as you said, you were there in Geneva in the part of the year where there is the World Health Assembly. So the full
Yeah.
immersion into WHO's meeting of 194 health ministers in the Palais des Nations. Do you still have your impression of how this felt when you went in there for the first time?
Yeah, yeah. It was I will say it was a sight to behold. I think even till this day I'm still reflecting on my experience at the World Health Assembly for the first time. Seeing the different countries represented, seeing the different civil society organizations, um, all in one building, all in one week, everyone uh, really advocating for issues that are directly connected to them and the community they represent. And so being with the World Federation of Public Health Associations and having access to the World Health Assembly and walking in and looking around and seeing, I will say my world view expanded. I think the lens in which I viewed global health or global public health, let's say, evolved that day and that week actually, and seeing how grand of how not so much grand, but I believe how connected we all are. Hearing a country speak about a health issue, speak about social justice issues, speak about health equity, and hearing that, and they can be, say, a small island state, and that same issue happening in a large, high income region, and they're struggling trying to figure it out. And for me, it was an opportunity to being able to build multiple bridges between similar health issues, but from different countries. And of course, I will say, as I alluded to at the beginning of this, having this energy and passion, I am wanting to connect with people and understanding their work and understanding what brings you here and being able to share and learn from each other. Um, where I was seated at the World Health Assembly, it was like the top deck, and so everyone who was I was seated with a group of medical students and pharmacy students, and the pharmacy students had a large delegation. And so I was able to connect with about 15 pharmacists, I think half of which I'm still connected to till this day. And that upper deck, it was awesome. It felt like a party almost, because at that time they also had live music at the World Health Assembly. I think they still do. They have an indigenous group come and play music, and it was they had a symphony, and it was like, this is an experience. And so And so, yes, the World Health Assembly during that time, and I would imagine even years after, I will say COVID probably has changed things. Um, for me, it was quite transformative.
Yeah. Thank you very much. This was World Health Assembly before COVID and
Yes,
before a lot of other, I would say, not only global health, but global events.
yes,
And this is, I would say, your first steps with the World Federation. Now, as
yeah,
I said at the beginning, you are definitely in a senior role.
yeah.
And a bit of this also was starting with work around the pandemic treaty. And as we know, the um, World Health Assembly will vote on the now concluded pandemic treaty this
Mhm.
May to come. I think this really was work on how global health works in practical. And perhaps now you work there, and also how we then created the Global Public Health Task Force. Let's start with the pandemic treaty and your views on the pandemic treaty.
Yes, thank you, Bettina. And yes, you mentioning the global public health task force and the pandemic treaty. And so the global public health task force and the work that we've done, we really prioritize embedding equity, accountability, and local ownership into the pandemic treaty. And that's really the lens to a degree in which we were engaged in the discussions and being able to evaluate some of the outcomes. And so as a task force, I will say our focus is essentially on ensuring that the treaty shifts away from this reactive model towards a more proactive, prevention-based global health architecture, so to speak. And so, in many ways, this includes advocating for the integration of civil society voices. As we know, that's very, very critical. Public health associations, which we have a number of members within the Federation, and most importantly, community level actors into both the planning and response mechanisms. And so we're, as a task force, are pushing for stronger commitments to financing health systems, which ensures to a degree the sustainability of our efforts, technology transfer, capacity building as well. And so as it pertains to the pandemic treaty, um, it has the potential really to transform global health governance as it pertains to how we respond, prepare, and prevent pandemics, really by introducing um, a legally binding framework or legally binding norms on preparedness, data sharing, as I mentioned, and access to countermeasures, and establishing really a more multilateral, cooperative, and decolonized global health order to a degree. And so for us, transformation means that the pandemic prevention and response are no longer controlled solely by high-income countries or centralized agencies, but co-owned by the global community through transparent, inclusive systems of accountability and shared responsibility. And as you know, Bettina, and as you mentioned, as we approach the World Health Assembly in about 2 weeks, um, the conversation around implementation, I will say, has already begun. And so and I guess that's something I probably will touch on later on in this podcast. But I think that is the true practical element of all of this is the feasibility of how countries are able to implement what they've agreed on.
Hmm. Yes. Let's put the pandemic treaty a little aside for a moment and
Mm,
turn to the Global Public Health Task Force, because this
yes.
task force now not only works with WHO, but also other agencies that work on global health. And yes, you are definitely representing us in another international city. Could you perhaps talk about the Global Public Health Workforce and its role in UN at New York?
Yeah, yes. So the whole purpose of and my role here in New York and representing the task force is not, of course, not solely on the pandemic treaty, but there's a wide range of critical health issues um, that have been on the agenda. One of which, one of the high level meetings last year was focused on TB. Right now, we have a focus on mental health as it's been included in the high level meeting for NCDs. And so, for the Global Public Health Task Force, is to be able to work on these diverse issues, right? But provide a lens in which we do so. And so, I mentioned equity as one of the critical points, social justice, decolonization, uh, and accountability, right? And so, as a task force, within my role in engaging different stakeholders here in New York and attending the UNHQ, and being able to understand what are some of the challenges countries are experiencing for the World Federation of Public Health Associations, who do we engage and what evidence can we put out there to then help support high level engagement. And I will say this task force is quite unique in many ways. We have um, a very diverse group of individuals who have different skill sets that complement each other. And we have the ability to apply, I will say, a systems thinking lens in how we view these very complex issues and being able to decouple I will say, the complex interlinkages of these issues, given the fact that we are dealing with, of course, a lot countries are dealing with a wide range of protracted crises. We have climate change issues. We have certain political instability and a wide range of other things. And countries are still dealing with a number of different outbreaks of certain pathogens of zoonotic origin. And so the Global Public Health Task Force, I will say, our capabilities in being able to assess uh, these um, these widespread issues, but then also being able to offer insight into what are the deeper meaning or the nuanced aspects of these issues. That then we can provide further insights to our member public health associations and other collaborators as well.
Yeah. And to those who listen to us, I would underline a very important role that you very nicely didn't mention. You're a great host to those of our members who are a little bit lost when they approach the UN system or the
Yeah,
UN
yeah.
in New York. You just guide them through. And I think this is an important role. And we have to be thankful and grateful to you for being that. So thanks a
Well,
lot. I'm
of course.
it's it's also, I think, very close to how you experienced. You started somewhere, you know how it is when you approach the first time. So you are the best guide I could imagine for those of our members, especially the younger ones who come for the first time to New York or other UN places. So thank you so much. I'm very, very glad you're here with us. And now you will be in Geneva in 2 weeks'
Yeah.
time. Yeah,
Mhm,
we're looking forward to that. We will be
mhm.
listening on the member countries to vote on the concluded pandemic treaty, but we both think, and we already discussed, that this work is not done, but it's a beginning of a lot of work.
Yes.
If you could perhaps go into further detail about what we want to ask the Assembly and where we prepare a statement on
Yes, definitely.
implementation.
The first thing that comes to mind, just kind of thinking about some of the bigger challenges and some of the things that we want to make sure that are addressed. And pertains to a lot of the conversations that we've had, is bridging the deep trust gap between countries and between institutions, and making sure that issues around equitable access to vaccines, intellectual property waivers, and financing, these are some of the issues that need to be discussed. But ultimately, I think one of our focuses is that social justice piece, um, equity. And I will say that high-income countries, to a degree, often, prioritize sovereignty and innovation protection, while and these are just the classifications that are used: high-income countries, low-income countries, and these are some of the terms that we have to figure our way around. Instead of classifying them in this way, but there are other countries that focus on solidarity and justice, and so I will say that these divergent priorities make it quite difficult to reach consensus on key provisions, and then it also, on the implementation side, then can also translate to issues in certain bottlenecks that prevent efficient implementation. And so, to a degree, in Geneva at the World Health Assembly, of course, there will be a number of working groups and task forces represented. Our focus is, of course, on strategic engagement, and being able to have dialogue with stakeholders across all regions, and producing statements and hopefully, policy briefs where needed that are rooted in evidence and lived experience, and pushing for language, and pushing for um, um, a focus of course, the pandemic treaty, but that reflects differentiated responsibilities and contextualized capacities. And so, I will say we plan on promoting this idea to a degree that inclusivity leads to effectiveness, right? And so, without equitable representation and compliance mechanisms, as it pertains to, say, implementation, the treaty then risks just becoming a piece of paper that then just sits on a hard drive. And so I will imagine that we um, um, being able to uh, understand the perspectives of member states and civil society organizations and their thoughts around implementation and thoughts around what this means for their communities. I think as a federation, and some of the thoughts that we want to get across in the statement is that we can't do this alone, right? And so one outbreak in another country can lead an outbreak in another. And so I think this is our planet. This is one planet, and this is the only one we have, and it's likely the only one we'll get. And so, yeah, solidarity and collaboration is definitely key statements to be made at the World Health Assembly this year.
Yeah. I think we will have a lot of things to do to get this implemented. And someone like you who does spend his free days doing field work in Zambia
Yeah.
is probably a good person to get implementation of, in for the moment, text into reality, the right person. And I'm looking forward to work with you on these aspects. But
Yes.
we do both have, and this is for our audience not so clear, we have a little
Yeah.
soft spot for the laboratory work. I'm a trained
Yes.
histopathologist, and you are a trained microbiology, hematology, and field epidemiologist.
Mhm.
So, my question to you is, where do you see the links between this kind of closed world of lab work and public health that looks like open and public?
Yes, yeah. There are many, many links. I will say that when it comes to diagnostics, when it comes to the laboratory, when it comes to um, these systems, one of my favorite words is the bridges, right? Building bridges. And so what happens in the laboratory is impacted by what happens in the community. What happens in the community is impacted on what the laboratory is able to do. And then that is housed within a health system that is meant to provide resources to the laboratory to respond, and the community to then mount an effective response to address a lot of the issues that they're faced with. And so for me, a lot of my focus now, of course, is on diagnostics, which are really the front line of pandemic detection and containment. And so, without timely, accurate, and accessible diagnostic tools, surveillance systems collapse, and pandemics spiral really unchecked. And so in my mind and in my work and from what I'm seeing, and Bettina, you share this to a degree as well, we must prioritize universal access to diagnostics. I mean, one of the main things I've seen in Zambia, and I'll be doing more field work this summer, and I'm excited for the World Health Assembly to see the conversations around laboratory response and preparedness pertains to universal access to vaccines, universal access to rapid diagnostic tests. The WHO has their essential diagnostics list, and so um, when new pathogens emerge, how are we anticipating the development of these diagnostics to adequately respond these diagnostics as it pertains to their sensitivity and specificity? What does that look like? And so in doing field work and in training community health workers and being able to utilize these diagnostics to be able to detect any type of spread early on, the question becomes um, uh, um, how useful are these diagnostics? How sustainable are they? And so, um, and on the laboratory side, what systems are set up to ensure that they're able to respond effectively? And so, one of the main areas, and I'm kind of thinking now into the future now, because this is a lot of the future work that will be done, is being able to develop response plans that are sensitive to vulnerable populations who typically are not captured under surveillance systems that are designed, mobile populations, and what have you. And so I believe that the laboratory plays a crucial role in how they establish certain criteria when it comes to prioritizing testing and what have you. And so yeah, a lot of critical issues, I will say, and I'm very interested to see what the response will look like.
Yeah, thank you. So the lab as a little bit of overlooked step and milestone in public health, the good diagnostic that could be a very strong supporter of universal health coverage when
Yes,
correctly done. Um,
yes, yes,
that's perhaps
yeah,
what I hear you saying behind all your work in the field and your understanding. Well,
yeah,
also promote this aspect if we will be able to do so. But I think the global health community is more and more aware of the importance of this side. Um,
yeah.
it is,
I agree.
oh,
I
yes.
agree. No, I agree. I just want to second that. I think of course, we've worked in the laboratory for quite some time, and then getting into global health work and policy work, we still have our roots in it. And so I think it's a very important area, and in many ways, I think the innovation around AI and the innovation around machine learning and how that's being incorporated into the work, I will say, Bettina, is becoming more and more involved, and things are becoming more automated, and things are becoming more uh, 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 technologically sophisticated, and so I think that's another piece, right? Like, how are we growing with the technology as well? When we talk about surveillance systems, disease detection, uh, diagnostics, laboratory testing, like what does that look like? I just read a paper 2 days ago that was posted on LinkedIn around utilizing AI to that has been integrated into HIV testing, and AI algorithms being able to then determine positive, negative in a very automated way. And so it's just completely removing the human being from, I guess the human being will just need to be able to write the lines of code and press start, right? But I think that's the other piece I do want to throw in there as well.
Yeah. And well, I think for me, it's also if we have good new technology, which is coming up all the time, that everybody has access to it and that we do not give a first country's variant here and a second country's variant there. I'm very much and very critically looking at these kind of developments as well. And I think it's, again, a very fine public task that we have to do. Yeah, so a lot of things to do, and it's important to
Yeah.
have someone like you, Emeka, who has, as I said, a senior role, and probably also you are a role model for our younger colleagues in the World Federation, I would say.
Thank
Um,
you.
and now I come to a question that I think bother all of us. Global health is quite challenged these times, and I would love to have your views on the challenges that global health is facing in today's geopolitical situation.
Yeah. Um, the first thing that comes to mind, and I think this is kind of um, gets repeated over and over again, I guess, to a degree, is the impact on climate change. We're looking at a lot of, and I've been reading a lot of literature on One Health that has been recently published, and the intersection of human health, animal health, and environment. And so we have that happening, right? Um, and then we also have on the other side as well, we also have, I guess, the silent pandemic and antimicrobial resistance. That's happening, right? Actually, today I'll be teaching a lecture on antibiotic susceptibility testing to my students, and so that's actively occurring. And then within all of that, I will say that there is um, uh, really challenges in how people or how communities are able to um, integrate cultures and integrate belief systems and integrate political beliefs and allowing that to occur in an organic way without it leading to tension, without it leading to conflict.
Mm,
And so as a scientist myself, okay, fine, I can appreciate the science of things, but there are also wider contextual issues that end up getting overlooked, and I guess to a degree, most take it for granted in not incorporating um, cultural beliefs or not incorporating one's viewpoint into, say, the design of, say, a public health intervention or into the development of a policy and being able to develop a policy because there is some type of financial incentive at the tail end of it, benefiting a very select few, as just as an example, versus looking at the community that will be subjected to that policy or subject to those political decisions, and how does that translate on the ground in improving their lives on a day-to-day basis. And so, yeah, I will say from a, I guess, a global health standpoint, we also have decolonization, those issues, those conversations are not happening enough. But I will say that here at the World Federation of Public Health Associations and with the colleagues that I've worked with, including yourself, Bettina, we are raising this and we're including this in statements and we're having conversations in informal and formal meetings and stakeholder engagements. And so, um, with saying all of that, I am a glass half full type of person. I am quite optimistic. Have I will say, a positive outlook on our efforts. I believe that our efforts will not and have not and they won't be in vain. And I think they are going towards they're going towards real change. And you mentioned the young people, the young professionals, of course, at the World Federation, the very large group. I was at the UNGA last year. They were able to represent in a very, very strong way, and they will also be represented in a strong way at the World Health Assembly this year. And so, being able to um, uh, see that flourish in a way that uh, that in many ways it fuels me, and I'm sure it fuels you and a lot of us in being inspired by the work that we're doing, and that it's also opening doors for those who are coming in and being able to carry on and take on the torch to fight the
mm.
fight. Uh,
This sounds like a real nice concluding word from your side. Your
Mm,
optimism, your half
yeah.
glass full. I think it's an important message. But anyway, before we really conclude, is there something that you have as a very personal message? It was already very personal, but very
Yeah.
personal message to the audience to really conclude this very fascinating discussion.
Yes, yes. Don't ignore your passion. Within us, we have a fire, we have a desire, we see the world that we live in. And so we should allow our passion to find its roots within the journey that we are embarking on. And so um, whenever I talk about the work I've done or my bio, or if I'm giving a presentation, what I reflect on within my journey is not stifling my passion and allowing that to grow and allowing that to flourish in the way it would like. And so um, in the midst of all the challenges, in the midst of all the bottlenecks, in the midst of all the range of issues that we see on a day-to-day basis, you turn on the TV, you watch the news, and there are things that are hard to see. But what I will say is it's important to see them. It's important to feel it. It's important to remind yourself that it's okay to feel, and and in many ways, we will find our footing where we need to.
Thank you so much, Emeka.
Thank you.
Thank you. I would like to say, number one, a pleasure directly talking to you, but a pleasure
Likewise,
to
Bettina.
have you on the World Federation since such a long time
Yeah,
and being the pillar and the supporter that you are, the voice in a certain way of the World Federation for Public Health Associations. Thank you, Emeka, and I wish you a great day with students, with work, and with the reality. But thank you for your passion. Thank you for your words.
thank you, Bettina. I really appreciate it.
Bye.